So for the last session, I have some guidelines for how to have a last session, especially if you know it's the last session. And for this class, it's going to look with a half an hour. And I think the information I have, there's a handout that says 5 to 10 minutes or something like that. So those are guidelines so that you can expand some of that time if you end up having longer sessions after this class. So the first 5 to 10 minutes is a catch up, just like what you've been doing. Tell me what's been going on between last time and this time. And the next chunk of time is to continue a little bit, just a little bit, with the processing, things that they're coming in for to begin with. And then the next section is about summarizing the work that you've done. I would suggest that up to this point, if you have done all the summarizing, let the client summarize. I hope that up to this point, what you've done is alternated session from one session to the next, who summarizes what happened the last session. If you ask a client to summarize, you have a much better sense of what they are getting from the sessions than if you summarize. So there's a real strong rationale for having a client summarize over you. So that's the next segment. Then the kind of the second to the last piece is getting a sense of any feedback from the client about what happened for them. So what was helpful or not so helpful? If we had to do it again, how would we do this differently or better? Now, most clients will say, oh, it was great, you were great. Unless you were somebody else's that would say, you regurgitated great, but you remember that, right? That'll be a class joke forever, right? And just like we've been doing for some of the other tasks for this class, you're going to say, for the purposes of my class, I need to make a referral. I don't know, but you might even before that to say, I'm not sure if it's something, if you would want to continue with counseling or not. And for the purposes of my class, I'm going to provide a couple of places for that you could continue with counseling, okay? And we'll talk about those. And then the last piece will be leaving the feedback and asking the client then to fill that out. So you can see how that can be sort of expanded or contracted depending on how long of a session you end up having. So you can do that really quickly if you've only got a very short amount of time, or you can do it in an extended session. I use that format if a client calls and says, I'm sorry, I'm not going to be able to make our next session, and actually I'm not going, I'm not going to be able to return. So over the phone, I'll follow some of that. Does that make sense? And I also start looking for signs that a client is done. And I have a little formula, and my formula is people come into counseling when their level of discomfort outweighs their level of comfort. And sometimes that's a very quick rebalancing, which is why I think that the modal number of sessions is 1, because we've all experienced talking about something sometimes just makes us feel better. Or we don't make a good connection with someone, so we know this is not going to work. So I think those are a couple of reasons that we have 1 session. But if we built a good relationship with folks, then we're going to know when they're ready to be done. And I know that's lots of words instead of just being done, but folks will start, and I wish I could tell you what some of the clues are, and at this point they're so unconscious for me, I'm looking for them. Or they might be things like, I'm feeling so much better now. I'm feeling so much better now. Right? Or I can't believe how far I've come since the first session. Right? Those are clues. You hear them? Mm-hmm. Or I feel like I have a pretty good handle on things at this point. Those are clues that they're ready to be done. And then I would ask them, so how many more sessions do you think it might take? And you'll know, because they'll say, I was thinking, because they'll think about it before they even come in, before they really tell you, I was thinking that this one might be our last one. So if you've got a formula, like what I just talked about, for ending a session, you'll be able to do it just like that, right? Questions? So I need a practice client. Who hasn't volunteered yet to be? And I know you have. You have. You? Who else has? You have.
When you want to practice, you want us to be our current client?
Or some combination, yeah. Ugh.
Well, if I am her, I could learn how to.
Yeah. Yeah.
All right, I'll do it.
So I know that we've been talking this is our 6th session, which for the purposes of the extra credit that you've been getting is our last session. And I wanted to kind of give you just a real brief overview of what this session's going to look like, because it's going to be a little bit different than other sessions. So we'll just do a quick check-in about how things have been going. And we can kind of expand that a little bit, and then I'll make a transition at about quarter after to talk about what's been helpful and what's not, and feedback time, and then for the purposes of this class, I'll make a referral, but I'll check in with you about that as well. Okay. So what's happened between last time and this?
Things are good. I'm not too stressed anymore.
Mm-hmm.
And I worked on my in-between session plan, and that went really well, so I was
Mm-hmm.
excited about that.
You said it went really well.
Yeah, I just had to think about people's intentions when they maybe are saying something negative about one of my friends, and not be ready to jump in and defend them.
Mm-hmm.
Because I tend to do that a lot with everyone.
So you're starting to pause more
Right.
before jumping in.
Yeah. I did it one time, and I was excited about that.
Will you kind of give me a breakdown of how it happened?
Yeah, I was with my boyfriend, and he my roommate's been a little bit crazy this week, and he kind of made a comment that was kind of negative about her.
Mm-hmm.
And I know he doesn't wish ill against her, so at first I started to get upset about it, and then I thought about it, and I knew that he wasn't, he doesn't hate her or anything.
Mm-hmm.
But he was just making a comment about the situation, and so I let it go, and I didn't defend her, and I was really happy about that.
Congratulations, that's a big step. How did you remember?
Well, I just have been thinking about it this week, and I didn't even know if I would have a chance to try it, but that one opportunity came.
Mm-hmm. Mm-hmm. So you thought about it. We had certainly talked about it the last time. You thought about it, and this opportunity presented itself, and you were able to say, "What? I'm not clear about what happened up here, in terms of your thinking."
I didn't just didn't jump in to defend my friends, and I just took what was being said and thought about it, and I was happy about that.
Well, so I'm trying to get an idea of what were some of the thoughts that you had, and what were you telling yourself?
Just that it wasn't my responsibility to defend my friend, and that he didn't mean anything bad against her. He was just stating what he thought about the situation.
And it worked out. You also said something else about that just because he was saying something like that didn't mean he hated her. So there's something about that statement that maybe is part of the thoughts that you have in the whole process.
Yeah, I don't like a lot of negativity, so I don't like people saying negative things about someone else. And so that's why I jump in to defend people. I try to I don't like to hear it when someone says something negative about someone I care about.
And then for you, then jumping in has really been a sign of caring for people. Someone would know that you care about them if you jump in to defend them. And that really kind of makes you feel like you have a purpose or a meaning in someone else's life.
Yeah, sometimes I feel like I love people too much.
You've said that before in here. You love people too much. That's pretty powerful. You love people too much.
Yeah. I care about what they think.
So I'm kind of thinking that might be two different things. That you love people too much and you care about what they think. I see some differences in that. What do you see?
I just try to keep everyone happy. I try to be a very positive person, and that's why I don't like people talking negative about other people.
So when people talk negative about other people, what happens inside you?
I just don't like to deal with it. I don't like to hear it.
Okay, so that's a thought. I don't like to deal with it, but what happens inside you, just sort of on a sensing level? Where do you feel it in your body?
Probably here.
Okay.
My chest.
All right. That's I love people too much. Because I'm asking because sometimes when other clients have said, when I hear negative thoughts, I get it here or even lower. Or some people have felt here, like it's a headache. But yours, it's like right here. And that's how you know you care. So you try really hard to be positive.
Yes, I do.
Really hard.
Yes. I don't like dealing with negativity.
So you don't like dealing with it, and that I'm guessing that makes you're uncomfortable when people are negative.
Yeah.
Uncomfortable.
Yeah, that would be a good way to say it.
Sad? Too?
Maybe a little bit.
Maybe just something to kind of sort through as you're disappointed.
Yeah, I guess I haven't thought much about why I don't like to deal with it.
Yeah. I wonder.
I just tend to push it aside.
Yeah. And the problem with that is that it starts to build up. Like you keep pushing stuff aside, there's this pile little bits at a time, then start becoming big bits, and eventually they topple. And we end up having to deal with all of that.
Yeah. Which is a problem, because I bottle it up, and then eventually I'll explode. I'll just
Okay.
let it all out.
That's the toppling, yeah. And the metaphor for that, it's like, you know, if you have a container that has a lid on it, and then you heat up whatever's in the container, it'll blow its lid. But if you have that lid on just so that it's loose enough that literally it lets off some steam, that makes a difference. And I know that we haven't had enough time to really get to that piece. It might be something for you to consider, is like, what would be some different strategies for loosening the lid so that you could let off some steam. It's kind of outside of the scope of what we were able to work on in the short time that we've worked together. So I want to shift gears a little bit, because this is our last session, and I wanted to give really do a review of what we've talked about, and then ask you for some feedback.
Okay.
I'd like to know from you, what are some of the highlights of the sessions that we've had?
I really appreciated just being able to come in and talk, and because I don't feel like I can really share openly with a lot of people, and so that's really been good. I feel better after our sessions, being able just to discuss some of my family problems and how to maybe deal with my emotions a little better, and also just, you know, trying to just be mindful of when I jump in to defend people, or even just, I've been working on that deep breathing exercise, so I've been trying that too.
One of the sessions we practiced a skill, and that it sounds like you're still doing it. So you've actually been doing a couple of different things, the breathing as well as kind of stopping yourself.
Yeah.
That's some good progress in a pretty short amount of time.
Yeah.
Congratulations.
Thank you.
And then, what kind of feedback do you have for me?
Yeah, just you know, I just really, like I said, appreciated just, you know, I didn't feel like you were judging me. And that was really important, because, you know, like I said, I sometimes talk to other people, but I feel like they're constantly judging my family or my situation, and it was nice not to have to feel judged in here.
And as we look back over the sessions, if there's anything that you would, if we had a redo, what would we do differently? What would you want to have done differently?
I think it went pretty well. I mean, I don't know if there's a whole lot I would change.
Okay, thank you. And I just want you to know that this has been a real, an extraordinary experience for me. I really appreciate your willingness to volunteer. I've enjoyed being able to get to know you, and I am, I don't know if I have all the words that I want to have. I guess I want to say I feel honored to have been able to be a part of this small piece of your life. And thank you for being willing to talk in the sessions. So it sounds like you got some things from the work that we did. And I wonder whether you've thought about continuing with counseling after these sessions.
Yeah, I've thought about it, because I know we talked about how there's some things that I may need to have more time to work on, and I think I'd be open to looking into it.
Okay. I'm glad that you're saying that, cause that makes it easier for me. Cause I was gonna say, well, for the purposes of my class, I have to make a referral, so, I do want to then, I've written them down and you can have this, but, as a student, the counseling center here on campus is a very viable option for you. They have a 10-session limit, and I think that's per academic year. So, that means that you could even start now, even though it's short time through the end of the semester, and then pick up again in the fall, and that would be a whole other 10 sessions, I think, but you might wanna check that out.
Okay.
And then, pretty close by, the EVMS has a residence clinic that sees people on a sliding scale. And that's one that's staffed by psychiatry residents as well as clinical psychology, like interns.
Okay.
And I do wanna let you know that rarely will you get a human being answering the phone
Okay.
on that one. So if that is something that you'd rather do than the counseling center, what I would do is leave a message and let them know what your availability is for a call back.
Okay.
And of course, leave your name and phone number. And then this next one is an agency that's actually relatively close by, it's a few miles away, that also works with people on a sliding scale. So that's a pretty good possibility. And then just for the future too, most people have some form of insurance, and you might just call the insurance company to see who's on their panel or who's kind of close by.
Okay.
That works with folks who have a particular kind of concern or issue.
Okay.
So what's the likelihood then that you will follow up on this?
I think it would be good. I mean, I'm a little scared sometimes about going deeper into what we've talked about, but I think it would probably be better for me to really learn how to deal with my emotions, so like I don't feel like bottle it up and have explosions like that.
Yeah, you've had the explosions, and I would imagine that it might be a little bit challenging, as much as you might want it to be different. And yet at the same time, you made some pretty good changes in a pretty short amount of time with practicing the breathing, and then also remembering. I know it was only one time, but one time's a good start with stopping yourself from defending somebody. Again, thank you for your willingness to volunteer for this experience. And what I'm going to end up doing too is leaving an evaluation for you to fill out. And just like I did before, I'll leave the room and let you fill it out, and you can just leave it on the chair when you're done.
Okay.
Any questions?
No?
All right, thanks for coming in.
Thank you.